Have you ever wondered why pancreatic cancer is called the silent killer? Well, in 2025, we're learning these signs aren't so silent after all. I'm Dr. James from Pancreatic Cancer Warriors, and today I'm revealing the subtle warning signs that could save your life. Did you know that a recent diabetes diagnosis after age 50 could be your pancreas crying for help? It's not just about blood sugar. It's a potential red flag for something more serious. Let's start with unexplained weight loss. Are you shedding pounds without even trying? It might seem like a dream come true, but your pancreas could be sending a distress signal. Imagine catching this early. It could make all the difference. That's jaundice, and it's a classic sign that often appears before pain does. The kind that just won't go away, no matter what you do. Understanding them could be the key to early detection and better outcomes. We're not talking about shedding a few pounds after starting a new exercise routine. This is significant. Unintentional weight loss. Your body might be burning more calories than usual, or you might be losing muscle mass. It occurs when bilirubin, a yellowish pigment produced by the liver, builds up in your blood. This can happen if a tumor is blocking your bile duct. The yellowing often starts in the eyes before spreading to the skin. But when combined with other symptoms on this list, they become much more significant. However, if you're experiencing any of these signs, especially if they persist or worsen, it's crucial to consult with your healthcare provider. Pancreatic cancer can cause changes in your digestive system that make food less appealing or even nauseating. The earlier it's caught, the more treatment options are available, and the better the chances of survival. That's why understanding these warning signs is so important. It's not always obvious, so pay close attention to any changes in your skin tone or eye color. Part of the reason is the pancreas's location deep within the abdomen. It's surrounded by other organs, making it difficult to feel during routine physical exams. Additionally, the symptoms can be vague and easily attributed to other, less serious conditions. Subscribe to Pancreatic Cancer Warriors for more vital health alerts. Stay aware, stay vigilant, and stay healthy. Your pancreas and your life may depend on it. We're committed to bringing you the latest information and research in the fight against pancreatic cancer. Either way, it's a sign that your pancreas might not be functioning properly. If something doesn't feel right, don't hesitate to speak up. New screening methods are being developed and researched, but until we have foolproof early detection methods, awareness of these warning signs remains our best defense. Your healthcare provider is there to help, but they need your input to make an accurate diagnosis. Pancreatic cancer might be known as the silent killer, but together we can give it a voice and fight back. If you're experiencing this, it's time to get checked. The more people who are aware of these warning signs, the better chance we have of catching pancreatic cancer early. Pay attention to your body and any changes you notice. If you experience any of these symptoms, especially if they persist or worsen, don't hesitate to consult with your healthcare provider. Your pancreas plays a crucial role in regulating blood sugar. When it's under attack, your body's ability to process glucose can go haywire. If you've been diagnosed with diabetes after 50, especially if you don't have other risk factors, it's worth discussing with your doctor. Your body might be trying to tell you something important. But what if they're not? What if your body is desperately trying to tell you something important? Don't ignore it. It's your body's way of waving a big, yellow warning flag. It can be easy to dismiss as just another ache or pain, but if it persists or worsens, it's time to take action. Pancreatic cancer can affect your body's ability to digest fats properly. This can lead to stools that are pale, greasy, and float in the toilet. It's not a pleasant subject, but paying attention to these changes could save your life. This pain is often worse after eating or when lying down. Pale, floating stools might seem like a trivial thing, but your digestion could be revealing a bigger problem. Or maybe you're feeling nauseous more often than not. If this sounds familiar, it's time to listen to your body. These could be subtle hints that something's not quite right. It's not the most comfortable topic, but it's crucial to pay attention to these changes. Now, here's something you might not expect. New onset diabetes. Have you ever noticed someone's skin or eyes looking a bit yellow? Speaking of pain, let's talk about that deep, gnawing discomfort in your abdomen or back. Now, let's get a bit personal. Have you noticed changes in your stool? And what about your appetite? Has food suddenly started to repulse you? You might just save someone's life. And don't forget to subscribe for more vital health alerts from Pancreatic Cancer Warriors. We're here to keep you informed and empowered. Here is the scariest part. These symptoms often get dismissed as just stress or getting older. That's why it's crucial to share this information. Now, let's dive deeper into each of these warning signs. Unexplained weight loss is often the first sign that something's amiss. New-onset diabetes is particularly concerning when it appears in older adults. Jaundice is one of the more visible signs of pancreatic issues. Abdominal and back pain associated with pancreatic cancer is often described as a dull, aching sensation that radiates from the upper abdomen to the back. Changes in stool can be an embarrassing topic, but they're incredibly important. Loss of appetite and nausea are common symptoms of many conditions, which is why they're often overlooked. It is important to remember that having one or even several of these symptoms doesn't necessarily mean you have pancreatic cancer. Many other conditions can cause similar symptoms. Early detection is key when it comes to pancreatic cancer. But why is pancreatic cancer so hard to detect in its early stages? That's why it's crucial to be your own health advocate. Pay attention to your body. In 2025, we're making strides in pancreatic cancer detection and treatment. Remember, knowledge is power. By understanding these symptoms and sharing this information, you're not just protecting yourself, you're potentially saving lives. So, what can you do with this information? First and foremost, stay vigilant. Secondly, spread the word. Share this information with your friends and family. And finally, stay informed. Together, we can turn the tide against this devastating disease. Remember, early detection saves lives.